When you come in for an annual physical, the doctor hasn't seen you for a year, and I always feel like she's covered every single topic that is important to me and that I haven't had to necessarily ask or prompt it. I had a hard time sleeping. I was uncomfortable walking when I rode any more than about an hour in a car. I just was kind of wiped out, very uncomfortable, and so finally, mentioned it to Dr. Tembrell and told her that the approach I was using in terms of holistic, non-invasive, and she said, well, maybe 3 more months, but if not, we want to get you in for a hip x-ray and see if there's something else going on. And as it turned out, I had bone on bone, and there was a real physical reason for why I was experiencing the kind of pain that I had been experiencing. Surgery is not without risk. Nobody loves the idea of having your body cut. And the materials that they're using today, the surgeon explained to me, are they're longer lasting than if you think back 20 years ago where you were looking at you were going to have another joint replacement because of the life of the materials. So it's kind of one and done. Oh, well, I can tell you, the pain was immediately gone. I'm back swimming, I'm walking, I do yoga. Those are all things that I wasn't able to do before their hip replacement. So when you think about it, you need to, you're meeting with your primary physicians, Dr. Tembrell. She makes a referral to the surgeon. You get an x-ray, then all the pre-op education, the surgery, the hospital stay, and the rehab afterwards. It all took place in one place, OMC. And they worked as a team, and I felt like they knew me and they cared about me.